As dental hygienists, this is how we manage a patient that comes into our office with a history of myocardial infarction. Mr. Patient is visiting our dental office for dental hygiene services because he has concerns that his gums bleed and his mouth feels dirty. Upon review of his medical history, we learn that he had a myocardial infarction 4 months ago. He has occasional chest pain due to his recent heart attack. Mr. Patient also suffers from dental needle anxiety. Upon review of medical history, we learn that Mr. Patient could be taking anticoagulants such as Coumadin, which inhibit coagulation of the blood, digitalis drugs such as Linoxin, which increase blood flow, and/or antihypertensive agents such as amlodipine. These are calcium channel blockers and they lower blood pressure. How do we want to manage our patient? We know his MI occurred 4 months ago. Therefore, we want to request medical clearance from his cardiologist. We also want to request his INR results before pursuing any dental services. His INR value should be 3.5 or less for dental hygiene services. We want to schedule our patient for morning appointments to reduce stress, and we want to use minimal amounts of local anesthetic with epinephrine, a maximum of 2 cartridges with epinephrine. We recommend nitrous oxide oxygen sedation to reduce his dental/needle anxiety. Any interventions should address the patient's lifestyle changes and periodontal disease conditions.
Here is his intraoral image showing the condition of his gingiva. Patient has not been to the dental office since he had myocardial infarction. He could not brush his teeth well due to the residual pain. That from this image you can see that the patient have inflammation of the gingiva and have generalized calculus. This will happen if the patient will neglect his oral hygiene. Plaque accumulation which causes inflammation and lead to periodontal packeting, which results in tissue attachment loss and alveolar bone loss. That you can see the comparison from the image as normal tooth that has a healthy packaging about 1 to 3 millimeter, and the right side big image is showing periodontitis, that you can see that around the tooth has calculus. Treatment plan and recommendation to the patient. For this patient, it will be great if we can do root scaling and root planning for quartz with 3 months periodontal maintenance. And also to help a patient for dental anxiety, patient can have nitrous oxide sedation. And then for the sensitivity that happen after scaling and root planing, we can offer the patient in-office fluoride varnish. Also, the patient can alternate, instead of using manual toothbrush, he can use electric toothbrush for optimal plaque biofilm removal. And for his limited functional capability, is very useful if patient can alternate using water pick to help remove the plaque biofilm in between his teeth. And this is our references. Thank you very much for your watching our video.
Thank you very much.